I'm inspecting the abdomen for um, contour. I'm inspecting the abdomen for at the side of the bed for shape and for the shape and contour and the umbilicus area to make sure that the umbilicus area should be in the midline, and and there's no it should be inverted, and there's no discoloration or ulceration, and the shape of the abdomen is round, and checking on at the end of the bed is the symmetry of the abdomen. Okay, good. So now I'm gonna ask the patient if when was her bowel sounds. So when was your bowel sounds? Yesterday. Okay, good. Do you have any problems avoiding at all? No. Very good. So now here, now I'm gonna auscultate the four quadrants here, starting counterclockwise. So here is the right lower lobe, then right upper lobe. Going across is the left upper lobe and the left lower lobe. So we're basically listening for abdominal sounds, such as if it's normal, hypoactive, or hyperactive. So far I heard hyperactive sounds, hyperactive bowel sounds, and it is high pitched and loud and gargling, and also high pitched sound and gargling, and also if the bowel sounds is absent, you have to listen to it for 5 minutes. So now I'll be palpating, doing a light palpation. It should be 2 centimeters. Okay? So before I do that, do you feel any pain at all? No? Okay, good. So just palpating around, the abdomen for any tenderness or masses. And so far there's none. It is nice and soft. And I did not want to palpate before I auscultate, because if I palpate first before auscultation, I'd stimulate the bowel sounds. So now I'll be moving on to my GI. And do you feel any pain when urinating? Any problems when starting a stream? No. Okay, good. And his urine is clear and odorless. Now I'm going to do the musculoskeletal. So I'm going to ask you to lie down for me, Patty, please. Okay, good. So I'm pretty much inspecting for the shape and contour of the joints, and sit up, and same as the legs. Okay, shape and contour is symmetrical and rounded, angular, and also and I'm also gonna test her range of motion. So Patty, I'm just gonna ask you to raise your hand above your head. Okay, good. Okay, good. And your legs, just can you bend your legs for me like that, and then raise them up? Same thing on the other side. Okay, good. So she was able to perform range of motion freely without any limitation on the movement, and without any pain on the joints. And I will thank Patty for her time and cooperation, and I will lower the bed, side rails up, make sure that the bell is within reach, and I will thank the client, and that should conclude my assessment. Now I'll be doing my documentation, and I'll be doing my documentation and program for 30 minutes.